Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and George Andre.
Hello, everyone. Welcome to the Soft Bites podcast. Today we have a very special guest with us. Today we have Dr. Parul Dua Makkar with us, and we are really happy to have Dr. Parul with us today. I'm just going to make a short introduction of Dr. Parul. She is a fellow dentist. She completed her degree from the University of Oklahoma and a general practice residency from Staten Island University Hospital. She lives in New York. Prior to moving to New York, she lived and worked in Calgary, Canada. Her aim is to address all her patients' concerns that brought them to her and help them to live with a smile. She has two boys, and she's here today with us to share her brother's story, the story of Dr. Manu Dua. So, Parul, welcome to the Soft Bites podcast. It's thank you so much for being here with us. In this podcast, me and George Andrea, we try to reflect on how we can be happier as dentists, how we can be more authentic, more connected with ourselves when working. We think that's one of the secrets of happiness in dentistry, because we all know that dentistry is a beautiful profession but has a lot of challenges. And I think that our conversation here today is going to bring many insights for all the colleagues that are going to listen to us. So I've introduced you briefly, but can you please tell us a little bit more about you, about your journey, and also to introduce us to your late brother and to his story?
Sure. So first of all, thank you so much, both Manuela and George Andre, for having me here. It's such a pleasure. Absolutely. A little bit about me. Like you said, I'm a general dentist, and I was doing all things dentistry, drill, fill, bill, until life took a trajectory that I had never anticipated in my wildest dreams. My younger and only sibling, Manu, was diagnosed with oral cancer, and he was a practicing dentist in Canada, in Calgary. And, he had a dissatisfaction with the profession, and he talks about that in his articles and his writings. And unfortunately, it took cancer for him to exit the profession. He left after he had an initial surgery, and the cancer returned, and that's when he decided he's going to step away from practicing. And he writes about how cancer gave him a ticket out. And unfortunately, there are lots of us who in some way are not happy with the profession, even though it's a rewarding profession. There are just aspects of it, and it can be very daunting, isolating. We're in our little bubbles with a lot of stress factors. And if we don't find the right outlets and be, like you said, mindful in our thinking, it can take negative effects. And Manu recognized those and a little too late. And I just hope with sharing his story, sharing his journey, that it's not late for somebody else, and we can be more better versions of ourselves.
So thank you very much for that. Thank you so much for that, for being willing to share his story, to be able to contribute positively to many of us who I think that pretty much all of us went through that delusion of that less positive aspect of dentistry. I think it's actually quite common. So I'd like to ask you, so how old was he when he passed away?
34.
34. And he went through the process during a pandemic. How was that?
That is the most challenging of all because, I was in the US and he was in Canada and our borders were shut. For me to travel, I had to do a compassion release from the government of Canada, which is a lot of paperwork to be signed by doctors, to be signed by him, so that I didn't have to um, isolate myself, because usually when you traveled internationally during COVID, you had to isolate for a week or 2 weeks, do PCR testing. I could avoid that with a compassion release. So there was a lot of paperwork um, that was involved. There was a lot of uncertainty because the time that I knew that Manu was going to, or he didn't have much time on his hands. That was December. That was before vaccination. So for my parents to allow me to come, because they had to sign off on this paperwork that yes, she's going to isolate in our house. It was very challenging because my husband was worried about me having to travel without vaccinations. We didn't know what the consequences were traveling by air. We didn't know if I would get infected. We're traveling to an immunocompromised patient, my elderly parents. So there were so many factors that, yes, we're dealing with cancer, and yes, we're dealing with the treatment and the negative outcome. We knew time was limited, and having to navigate that with COVID was just the worst situation, the worst times, in the worst possible way. And compounded with the fact that as Manu went into hospice, he was admitted to the hospital on Friday, went to hospice on Saturday. And luckily, I had my paperwork because it's only valid for a month. And then, so that was in December, and I flew again in March. Luckily, I had all my paperwork. Had I not, I would have not made it to the funeral. And what was holding me back was PCR testing. That's why I missed him by one day. When I knew he was in hospice, it was a matter of hours. And what inhibited me to take a plane was a PCR test, and it was taking record time, 3 days. I didn't have 3 days. I had maybe a day. And so, and while I'm trying to navigate that, it's like, oh, PCR testing, how can I get tested? Who's able to test this faster? These are not things we should have to think of when we know our loved one is dying. And I consider myself lucky I made it to the funeral and I got to be there to say the last goodbye that a lot of people didn't have. COVID stole that from them. And I consider I'm not ungrateful for that. But it just made the whole situation very challenging. Even at the day of the funeral, I was on with phone with the Canadian consulate to give me a limited release to attend the funeral, because only 20 people are allowed, but I am going to a funeral home. There are all these roadblocks being checked on by the authorities. You check into the ArriveCan app. There were all these protocols that I had to manage while dealing with the death. So I wish that on no one else. And because we couldn't have a proper funeral with our loved ones, we couldn't get, when you travel through grief, you want a village around you protecting you. You want people comforting you. You want hugs. You want just somebody to see a friendly face. And Manu didn't have that during his treatment. A lot of his treatment was in isolation because of COVID. He didn't have somebody with him during the appointments, during chemotherapy, during radiation. He was alone, and we were alone in our grief. And so it's very unique challenges that COVID brought upon, for sure.
Manu going through his cancer journey alone, did he find peace in writing? Because he documented all the process through his blog. Was it
Yes.
something that he already did before, or it was something that he discovered with this journey, and with the fact that he was alone, like you just said, due to the pandemic? How did this blog and how did this writing and the writing through the process come about? And do you think that it helped him with this journey?
Absolutely. So he initially started writing about his cancer. He talked about it in the Dental Town, and that was in September when he was featured on the cover. And it was about his startup practice in Calgary, how he had started Patient Zero and built this practice. And then he talks about Dr. Heal Thyself. That's the article he published. And it was because I think there was such a lack of understanding of what you're going through at the age of 33 that he had half his tongue resected and grafted. He had big scars. He had scars of the neck dissection, the thyroid, the feeding tube. So he had all these disfigurements, and I wouldn't say that, scars on his body that spoke of his journey through cancer. And there was such a lack, I guess, of understanding. And I think that is because we didn't go through it. I didn't go through it because I was navigating through other things in my life. I didn't get that he was facing, this stolen identity almost. He was this fit person who played rugby, who did all these things. He was up and going, happy go lucky guy. And when he was at the peak of his life, he got hit with this diagnosis where he was almost in like denial of. So when he started writing, it brought him connections to other people that understood his journey and that brought him comfort. And he initiated it. And then when the cancer was more aggressive and when he was devoid of now not only his family not truly understanding what he's facing, having to face death a few times when he's unable to breathe, when he had fluid build up, he had to go back and forth the hospital, unable to walk, unable to make a few sentences. That's when he really, like, mentally, he was all there. His mind was very active, but he couldn't verbalize. So this was just this outlet that he needed, and that brought him connections to other people, and it gave him a sense of healing that that his closest friends and family could not.
Mhm.
Yeah.
Life Interrupted, Dr. Dua's Survival Guide, is a book that you edited after his death to honor him. How did Life Interrupted came to be? Because it's his texts, right? So it's his blog texts. Why
Yes.
did you decide
So
to edit this book?
So when I saw Manu for the last time alive in December of 2020, and all we did was watch movies and listen to songs. There was nothing else. It was frigid cold in Calgary. He wouldn't go out for a walk, and he was showing me his writings, and he said, I want to be published. And I said, all right, you have nothing else. He was single, no kids. There was no other distractions to keep him off cancer. I said, all right, you focus on writing. I will find you a publisher. And I found a publisher, and we were in talks. And in February, I said, the publisher, I found somebody, they're ready to publish your book. Let's get all your writings. I need all your original documents. He's like, relax. I got time. I want to write more. Don't push me. I'm like, all right, fine. You do what you want. Finish your writing, but I have somebody who's interested. And unfortunately, time was not on his hands, and he passed. And he used to call his blogs Dr. Dua Survival Guide. So after his death, I went to his house and I opened his mail to get the Dental Town magazine where his last article about leaving dentistry this way out was published, and it's in the book. And I walk into his house and everything was there, because he got rushed to the hospital. He went straight to hospice on Saturday and died on Sunday. So I walk in, he's got his Legos that are still unmade, his laptop sitting there, his food that he wanted to eat. He was rushed right after dinner. Dirty dishes are still in the sink. I mean, his blanket where he lay, everything was there but him. It was his life interrupted, and that's where the title comes from. And then I got on his laptop and I helped finish the story he started because he had written such important aspects about life while facing mortality. He knew his time was limited and he wasn't angry. at what life, the cards he was dealt with, he accepted his fate and he had made peace with it. And if I'd left that on his laptop in the Dropbox, nobody would see and nobody would benefit from it. And I couldn't do anything for him as a sister, as a daughter, as a dentist. I couldn't help him because of the circumstances that we were in with COVID. So my way to honor him and was to grant his last desire to be published. So I got it together. I completed his story on his laptop, and it was my way to cope with the grief. And also, it just helped create something that hopefully somebody will look at and be positively affected by it. It was just my way to honor him.
Your brother's experience was very powerful and very inspiring, especially for the dental community. He had his own clinic at that point, and he had some bank loans and he was a bit concerned for what we have read on these articles. He was concerned with the future of his staff, the future of his patients, the financial situation. How did he cope with that? Do you have any idea how he was feeling about that?
He was very concerned about it. And that's why, like, his initial surgery was in August, and he was back seeing patients in October. Because he was so concerned about his patients, his practice, the staff, he didn't want the practice to be so shut down. This is pre-COVID. Then COVID hit, and the cancer came back simultaneously. That's when he decided, you know what, I'm going to focus on me. I'm going to focus on my health, and I'm going to focus on getting better and say goodbye to dentistry. So luckily for him, he was able to sell the practice to somebody that helped take care of the bills, and he let go, and which was good because it would have been very hard for my parents who are non-dental to sell that practice. So he tried to take care of all that he possibly could while he was still sick, and he sold his practice while receiving chemo and radiation treatment. He was getting that treatment during that summer, and he did it all by himself. So he wanted to make sure somebody good got it, and he was awarded Best of Montgomery. That's where the city that he practiced in, award, while he was still alive. So he had felt gratifying to him that he had accomplished something, and his legacy still carries on. But yeah, he was able to sell it and make sure that good people got it, and not like a chain of dentistry like DSOs we have in the US. He sold it to an individual who would provide the same level of care. So it was very important to him.
But it's Parul, for what I understand, by reading his articles, when he had the first surgery, he still got back to the clinic, right? He still got back to work.
Mm-hmm. Yes.
So it was only after
that's right.
the cancer appeared again, and he had the second surgery, that he decided to sell the practice, right? But during the first surgery, even he had, with all he went through, he still went back to work. And at that time, he maintained the clinic, right? He had a colleague that he found to work at the clinic, to maintain the clinic, and he went back to work after that, right?
Mm-hmm. Yes. And he was finding, like, August, he had the surgery. September, he actually traveled to New York to see me. And October 1st, he was practicing. He hardly gave himself time. And when he started back work, and I remember he had half his tongue resected. So he had to learn how to chew, how to talk. He had a graft taken, radial nerve graft was taken from his left arm. So while he was practicing, he started to notice numbness if he walked for a long time, some mental fogness. He did have some, he couldn't work at the same level as he used to be able to work and attend that many patients. That was October. April 1st, he got the diagnosis that the cancer had returned, and March was when things were getting worse with COVID. So with that combination of cancer returning and COVID, he's like, it's time for me to wrap up. And then he consequently sold it by June of that year, 2020. Yeah.
I'm going to read that paragraph that we were actually talking before we start recording, and I'm going to read that paragraph that is from his first article published in Dental Town. By the way, I'm going to, on the episode notes, I'm going to put the links not only for the book but also for this articles that Manu wrote. But what he wrote on this first article was, I had until the point convinced myself to live in constant fear of failure, fear of rejection, fear of staffing issues, fear of clinic issues, and fear of life in general. The irony is, I didn't understood what real fear was until I was faced with one of the most frightening prospects, my cancer diagnosis. And I find this to describe dentists so well. So to live in fear of what might happen, imagine fear, and only when we face true fear, we realize that we don't know what true fear is. And Manu really put this into words, and this gives this very clear testimony when faced with his own mortality. But this is so again, I think it describes so well dentists that so common. I hear this all the time, and that's one of the reasons why mindfulness has works very well with dentists, because it gives this body-mind connection. But we have all this fear, and we aim to perfection. How this must have been very frightening, and it always is when someone is faced with such a hard reality. Was this hard for him to accept? Was this reality hard for him to accept in the beginning?
So it's a very loaded question. I can tell you how I think that how he felt, because
but did he ever talk to you about when was the first diagnosis? I mean, what did you feel were his feelings towards the diagnosis?
So yes, and I think I'm almost 8 years older than him. So he would always share with me first before telling my parents, even the cancer diagnosis, cancer recurring, also because I'm in the field and I know, and I can think like a clinician rather than just a parent or a sister. So he had shown me the initial lesion in June, and it was on his tongue. It had been there persistent for months. And that was June, just before his 33rd birthday. And I looked at it and I said, Manu, can you please get this checked out? Because I showed it to 5 other oral surgeons. And I said, what do you think this is? And everybody said cancer. And I told him, Manu, this is cancer. Get it biopsied. He's like, no, it can't be. I can't have cancer. I'm healthy. He's at the prime of his life. There was a lot of denial. There was a lot of arrogance in that. Cancer can't happen to me. And I think no 32-year-old wants to be diagnosed when you're at the top of your game. Like, you've built a startup practice. He's been on the cover of a magazine, that he's been on this podcast with Howard Friend. Like, he was on like the peak, like he was just in ecstasy of what he had accomplished in life. And at that point, he had just bought his first house. This is a second house. First house he was renting, second house he had bought the ideal house in just the way he wanted it. And he's like, I can't have cancer. This can't be it. I said, all right. So, and I flew in July, as I always do, to travel in the summertime to Calgary. And I said, Manu, show me your tongue. And that lesion that was like yay big, 5 centimeters, had grown like half his tongue. It was ulcerated, brown, but leathery. Couldn't eat certain things, couldn't talk properly. And I looked at him and I said, are you kidding me? Why haven't we looked at this? He's like, well, I did get steroid treatment. They think it's lichen planus. I had my wisdom teeth pulled out. He's like, I'm getting the biopsy once you leave. Again, I don't think he expected it to be cancer. And then once the biopsy came, And this is when we had celebrated his house. We'd done a housewarming. We did all those things. And when the biopsy came, he called me and he said, you know what? This is cancer. I'm stage 2. And once the surgery was done, I said, why didn't you get chemo and radiation right after the first surgery? And that is one of the biggest faults I felt in his treatment. While he was open and exposed, they could have radiated because the cancer returned back on the lymph nodes. He had a neck swelling consequently in a few months. So had he been radiated, had been more aggressive treatment, maybe he would have survived. But he said, there's a lot of side effects. My doctors are not pushing it. I'll be fine. I'm just going to go back to work. I've got all these bills to pay. I've got all this I'll be fine. I'm going to be good. So he was still so hopeful that he's beaten. And we planned a family trip, which COVID got canceled. And they found when his cancer returned in April of 2020, that's when he decided to leave practice. And they found a lesion on his chest, which was very small, too small to biopsy. And it was supposed to get followed up in 6 months, which got pushed to 7 months. In between these 7 months, he had gotten chemo radiation and he was thriving. He was out kayaking. The picture in the book is him kayaking. He was playing golf. He bought himself the car of his dreams. He bought a Porsche. He got a dog. Like, he started to do the things on his checkout because now he's faced cancer twice. And he said, I'm going to live for me and I'm going to do the things that bring me joy and why should I wait till I'm 60, 70 years old? He was still hopeful that he's going to survive.
And that is when he sold his practice,
This was the summer. He sold his practice. He's got chemo radiation done. He survived that. He's thriving. And this is after 2 rounds of surgery. Unfortunately, his follow-up from April was supposed to be in October. It didn't happen till November for his chest x-ray. And that chest x-ray showed that the lesion seen in April, which was small, had become 4 times the size. He was supposed to get a biopsy, but the biopsy did not happen because before the biopsy, he was admitted for failure to breathe, and that's when they discovered fluid in his lungs. But I remember him getting the chest x-ray and calling me that evening in November, and he said, I don't have the final diagnosis or the final report, but I've had my friend, a radiologist, read it, and this is metastatic. I am going to die, and I am ready for it. And that was in November of 2020. And I said, no, you can't die. There's got to be something. It could be something else. Let's wait for the official report. Let's wait for the biopsy. The biopsy was December 7th, but prior to that, he was admitted in the hospital, and that's when he got the Plorexin for draining the fluid that accumulated in his lungs. He was draining about 1 liter of fluid a day. And it was in his lung lining, so it was not operable at this point. So at this point, it was just a lot of palliative care, chemotherapy, immunotherapy, clinical trials, just to give him as much life possible.
I'd like to read you 2 paragraphs of when he, after the second surgery, which he already had his practice sold. I'm just going to read it for you.
Mm-hmm.
So he was writing, I felt such a deep sense of relief and release of tension, as if a great weight had been lifted off my shoulders. Over time, people around me noticed a great change in my personality. I felt more relaxed, calmer, just a better person overall. The fault was never with my profession. The fault was that I recognized the inner conflict, yet never had the courage to do something about it earlier. Unfortunately, it took a life-changing event to forcibly thrust me into a different frame of mind, and for that, despite the pain and turmoil, I am deeply grateful. As a transition into the new life, devoid of handpieces and hygiene checks, I find myself excited to explore all that is around me and engage the sense of self that died a long time ago, as I was forced to put a mask and pretend to be someone that I wasn't. The dark but beautiful side of facing your mortality at an early age is that you realize that death is the only ever-present factor and it respects no boundaries. The sooner we come to terms with this fact, the faster we can embrace our inner self and take full advantage of the precious years we may have left. In summary, if you deeply feel that what you are doing goes against every fiber of your body, spend some time doing some soul searching as to why you're actually there. You will be surprised that most of us have chosen our paths without an in-depth analysis as to what we actually want, and hence we are left with a deep sense of unfulfillment. This can lead you into two paths. On one, you realize your original sense of purpose and your why, and can lead you to a renewed sense of fulfillment. The other can identify a glaring gap between your present choices and your true need for fulfillment, and realize your true need and realize that on your current journey, the two will never meet. So when he wrote this, did he already have the notion that he was about to die when he wrote this?
Yes, totally. He knew. All the articles he started writing in September before knowing that it was metastatic after his second round of surgery. That's when he started. He needed a way to get out. He knew, he's like, I have faced death, in the face. And he knew he was going to die. Like the last essay that he wrote, on New Beginnings. And I found when I read that, I knew he knew the time was, it was a matter of time. Because this last essay that he wrote was in January of 2021 when he was admitted in the hospital for 2 weeks in isolation, complete isolation. Parents weren't allowed to come in. He shielded us from a lot of his diagnosis and treatment because he didn't want us to see him suffer, especially my parents were watching him deteriorate in front of his eyes. So he shielded us from his prognosis. He's like for example, he was admitted for high calcium levels. I'm like, Manu, why do you have high calcium levels? What's going on? Tell me. He's like, oh, I took too much calcium pills. No, it was because his PET scan showed that there was metastasis all the way down to his pelvic bone. He was losing calcium. His body was dying inside out. So that last article that he wrote and on New Beginnings, the last line, I can read this passage and why it's so meaningful. Yep. It says, and I quote, one of the most important things that I have learned during these turbulent and difficult times is to accept the loss of control and to continue to ride the wave day by day. The ability to focus and get through each day is imperative when your world collapses around you. I write this as I'm in a hospital bed with one lung almost collapsed from fluid. And to be perfectly honest, I have found my peace. I understand that every day is a new journey, and I focus on getting through the days, enjoying little victories, and having complete faith that the future will unfold as it should. And my worries and anxieties are normal but fruitless and will not help me define a new path in life. What is imperative is inner peace, strength, and truly believing that there will be a better life in this world or the next. And that's the last thing he wrote. And that when I read that, because he shared this with me, and he said, "What do you think?" And I'm like, I knew he knew. It's a matter of time. And he didn't fear anymore, right? Like how many times do we stop ourselves from doing something? And then once we overcome it, we feel more empowered that, you know what, I've faced this, I can do anything else. I can take on more challenges. And he's like, I faced the worst fear of all, of dying, of not being able to get up the next day and doing the things that we love, seeing the people that we love, knowing a certain form of certainty that, yes, when I get up tomorrow, I'll be able to do all X, Y, and Z. When we don't get up, we don't know what lies ahead. And there's so much uncertainty and unknown and fear of what lies ahead. He's like, I've faced that so many times. I've accepted death as an old friend, and it's fine. Whatever happens, how things will unfold, they will and just a part of letting go. And I think as dentists, we are so type A and we want to control everything in these little things. And we want to make the staff happy and the patients happy because God forbid we do something wrong. They'll put up a Google review and that will tarnish our reputation, or they'll badmouth us. And whatever it may be, it's just so out of our control. And we're always trying to control these things that we can't. And it's just letting go and just letting life takes you as it comes. So to find that, you know what, I can't control it, but let me do the things that I do enjoy, that do bring me joy and happiness, that I'm doing for me, not because for somebody else to make them happy. Am I happy internally? And that's what this whole journey of his was, that live your best possible life. Whatever happens tomorrow, who knows? Tomorrow's not promised to anyone.
Yeah. So both me and Manuel, we thank you for that, because I think it's one of the messages that we've been trying to pass on to dentists, which is actually there's so many things out of our control, especially in dentistry. And regarding your brother, I would like to ask you some questions of how he was before the diagnosis, how he was before cancer. So you were saying that he was on his top game. He was all out, a very extrovert individual. He was at the peak of his career. But then what we see when we read these articles after diagnosis, we see a very almost spiritual guy, almost very conscious, a very mindful, a very spiritual person. Do you ever heard him talking before the cancer about these things, or was he all out in dentistry? He just wanted to succeed. He just wanted to be successful. Did he ever mention to you that he was unhappy with the profession, or that he was maybe trying to find something outside dentistry that will fulfill him more? How are those two brothers different?
So yes, he did have dissatisfaction with the profession. I think he talked about this with his podcast. He was a guest on a podcast, and he says, I had this perception of dentistry that once you succeed, you're going to be kind of handed this golden, keys to happiness with all this money.
Yeah.
But he's like, it's hard work, and it's a lot of like aggravation, and there's a lot of dissatisfaction. And he talks about that and how expensive it is to become a dentist.
Parul, sorry to interrupt. We usually say here in the podcast that one of the worst things that can happen to you in dentistry is to be successful.
Yes.
Because it brings a lot of complexity.
It does.
Brings a lot of complexity. Yeah.
It does, because success comes with a price. What price did you pay to get there? Price.
So he was aware of that.
Yeah.
He was aware of that.
He's like, and he worked in rural areas to gain a knowledge and get higher income. But he talks about this in his podcast, what he sacrificed that 1 year working in rural town of Alberta, in like frigid cold, minus 50 degrees Celsius, in isolation, not a lot of public, social life, not close to family, friends, and nothing to do. It's a small town. And a lot of people trying to practice in big cities because they want that social interaction. He's like, I paid a price to earn that money and the skills. I paid that price in being away from my family. But I was able to gain knowledge, whatever, and now come and pay off my loans really quickly, my student loans. So he's like, it does come. And what price are you willing to pay at the end of the day? And are you comfortable paying that price? So he had acknowledged these were the things he was starting to realize, but he wasn't ever very spiritual. And he was an atheist, didn't believe in God, for whatever matters. But he was never a spiritual person. And I felt like when he started writing and going through his cancer and facing death so closely, he had reached this, supreme divine, reached a place of nirvana. And I feel like he was just an old soul in a young body. So he may not have been in human years old, but his soul was an old soul, and he found his purpose. He wrote his writings, and he was done. His job was done.
He was brave, basically.
Very brave. He was always brave, and he never shied away. Like, he was very straightforward. There was no shades of gray with him. It was black or white. He told you like it was, and that is true with all his friends, all his peers, even among us as parents and as an older sister. He would tell me off, like, "You're not doing this right. You should be doing this instead." There was no like, "Let me sugarcoat this and tell you." He knew what he wanted and he went for it. So he was very brave in that sense, always.
Parul,
Yeah.
besides the book, you also recorded a podcast where you talked to friends and colleagues of Manu and friends of yours also. I heard the podcast last year. The podcast named, by the way, is Life Interrupted, Dr. Dua's Survival Guide, the podcast companion. How was that experience? How was that experience of talking with friends and colleagues? And did this help you? Did it help your healing process, your grief process? Because I can imagine that it's like you said, when you are suffering, you want people around you, and you want to be able to get comfort. Did this conversations helped you on your grief process?
Absolutely. Absolutely. Because just to remind your listeners, I lost my only sibling. So the bonds that you share with a sibling are very unique. They're very different than a parent child. And especially losing a younger sibling is just so out of the norm. It's not the natural form of life. And so losing that and not have anybody to share with, compounded with the fact that my parents lived apart in a different country, I couldn't share Manu with him. And they were in their own sense of grief, and they didn't understand, or they didn't understand my loss. Because for them, they still had another child and grandkids. I have no other siblings. And once they cross over, I won't have a sense of my core family with me. And that's that realization. And I didn't have my grandparents. I lost my grandparents the same year. I don't have any cousins around me. I didn't have any of my close friends who I've grown up with, because I've grown up in different parts of the world. So that grief, I didn't have that village protecting me, sharing stories, comforting. Then on top of it was COVID. So that when you go to a funeral, you get to see your loved ones and you get to go through that grieving process and meet people. I didn't have that either. So I was in a lot of isolation with my grief process. And this podcast helped me connect to the people who knew Manu the best, who were there in his last days, where I couldn't even be there for him in the last days. So they gave me an insight to Manu, a different aspect of Manu, like how you are with friends is different than you are with your siblings. So those little stories, sharing those snippets, just sharing Manu, the essence of him. And it was just this unexpressed love and joy that even they didn't get a chance. A lot of them didn't make it to the funeral. And it was that unexpressed love that we had. And it was just a way to get some sort of a closure, some sort of a grieving village to help connect with and be like, yes, my grief is real. And yes, there are people who are mourning him just the way I am, just not because they're not physically close to me doesn't make the grief any less. And it was that combination. Yeah.
And what do you think that you have? I don't know if learned is a good word, but were there changes in your life, in the way that you see your profession, that you started to take because probably your brother would like you to do those?
Yes, a lot of changes. The way I practice dentistry, I stepped away from where I'm seeing a lot of Medicaid patients, a little bit different in Europe than in the US, and seeing more fee for service or different type of insurance patients where I could be with my patient rather than provide more quality than quantity, like having to see 30 patients a day. I can see my 5, 6 patients and still get paid reasonably well. So the way I practice dentistry, picking and choosing, and my manner of life, like finding a purpose. Like I would get up, go to work, see my kids, and I'm done. And it's creating this sense of like, and Manu talks about it, and that made me reflect. Tomorrow I'm gonna go. Whenever my time's up, it'll be up. And one day I'll be a footnote in my grandkids. Yes, I had a grandmother who did this. I'll be a footnote somewhere. But to leave some sort of a stamp or some sort of a way to leave a legacy, which Manu did. It's like, yes, I helped carry it on for him. It's his story. He started it. I'm just completing it. So it gave me a new defined purpose to help people who have traveled this journey and just didn't know how to cope with it. I didn't. I had to learn it. And, to learn grief, processing while being, I mean, there were so many times that Manu would say, oh, this has happened. When Manu went into hospice, I was seeing patients. I knew that Manu was going to die in a matter of days. I was still treating patients. And to step away, I'm crying in my office. Oh my God, this is happening. I can't do anything. That loss of control. I can't control the situation or anything, but I have to step out of this office and I have to go take care of somebody's filling or something trivial that maybe seemed
I
trivial to me, but
understand.
it's
We
big for
understand.
them, and refocus. So it's learning those coping skills and not to lose yourself in life, but like to get up and rise from it and to start over. And it's never too late. And I started over to redefine what I want to accomplish and finding my footing in this world. Yeah.
Yeah, and do you think that, like we said in the beginning, uh, both me and Manuel, we discuss a lot of these things here in the podcast, and we do see these common issues in dentistry all over the world. Whenever you practice dentistry, there's either insurance or private. You always have this pressure, like something like you were saying that is. Not that much important, but for dentists is like the big deal. After this experience, what do you think that dentists in their 20s and in their 30s they should be aware of that you don't think that they are aware of at this point of our education? And do you think that should start in dental schools?
Absolutely. I think it is how to manage stress because dentistry is stressful. And to realize you cannot please all the people all the time. Like that sense of like, we have to please our professors, we have to please our patients, we have to please our staff. It's like, if not everybody's supposed to be in your life always. They serve a purpose and they leave. You learn and you leave, and you learn and you grow. And Manu says, don't let failures define you. So what if you failed an exam? So what if you failed a year of your life? It's getting back, you failed a year of dentistry. So what? You can repeat it and do better and still get back on it if that's still what you want to do. It's like realizing that don't let them, don't let that, deviate you from what you're really wanting to do. Um, but it is, I don't think they teach us coping skills at all. The rejection, we're always like, we have to get the best grades. We have to be top of the class if you want to be in a specialty. We have to do well so that professors notice you for a research paper or to go out and do something. We're always like pushing ourselves to the edge. And if you notice, some of the students who are on the top of their class may not have great listening skills. We need listening skills to listen to our patients, to see why they're here in the first place, not focus on selling the most costliest treatment, but serving the purpose why the patient is in your office in the first place. What is the chief complaint? So it's recognizing these listening skills, coping skills, time management skills, and learning to love yourself at the end of the day. It doesn't matter. These little things doesn't matter. Your shiny composite or your shiny amalgam with, where you can see your face doesn't matter. What will matter is your patient left happy and your patient felt they were taken care of. That's what's going to matter at the end of the day.
Yeah. But don't you think that, for example, and the reality in the US is very different from the reality in Europe and in most of the world,
Yes.
because the amount of debt that you have to assume to do dentistry, it's just like this stamp for the next 10 years in your life. I mean, you have to. From one perspective, I do understand the amount of pressure, because it's really a heavy burden to be able to pay all that debt. So, what's the typical time that a dentist now in the US takes to pay the debt from his?
Oh my God. Could be 20 years. I don't know. I'm out of debt, but yes, there are people who are still paying their debts. I graduated a long time ago. My debt was smaller, but people who are getting out right now are $700,000 US in debt, depending on where you go, not compounded with the fact if you do a residency or fellowship or whatever. And we have 8 years after high school. In Europe, you go right after high school. So you don't have those extra
Yes.
3-4 years
Yes.
that we do. So that's if you get in the first time. If you don't get in, you're looking at 10 years. So it's a lot of time.
And pressure.
Right. And then you can't start on life because you have a debt, in the sense to buy a practice or to start a family, to buy a house. The things that you feel like you're given a golden ticket because you got into dental school, you're going to make these big bucks. It doesn't
But actually,
quite
that's
translate.
a little prison, isn't it?
It is. And I get it. I get the pressure and I get it. But that's a whole different ball of, a whole different Pandora's box to open up to why we got here in the first place.
Yeah.
But there is hope, and if you've chosen dentistry, practice it with a good heart and be kind to yourself.
Mm-hmm. Yeah,
because money will come and go.
Mm-hmm. Yeah, I think that yeah, and that has to do with what you were saying about dentists always having this need, or having this feeling that they need to always to please and always to be the best, and sometimes that forces them to wear this mask that they are not themselves, so they lose themselves in the process. So it's not easy due to all the challenges that the profession has. There in the US, there's this concern about the huge loans that we don't have here in Europe. But if you face all these challenges with authenticity, if you can really connect to yourself and be yourself, and to do what you find is the best dentistry, an authentic dentistry, the path gets easier. If you lose yourself along the process, then the path gets much difficult, and then it will lead you to very difficult journey. And I think that's one of the the messages of Manu is that don't lose yourself. Really try to be authentic and to stay connected. And just for a finish, Parul, if for the ones that are listening, I don't know if you have any message that you want to pass through, or that you would like for the ones listening
that your brother, or do you think that your brother might eventually want?
Mm-hmm.
Yeah. No, Manu always said, and I'll quote him here. He said that I'm going to phrase it right. And I quote him, "I would like to share my story that even in the worst of times, under the worst of circumstances, the human mind, body, and soul have a remarkable capacity to heal. We are more powerful than we can imagine." And I think that's so true. We forget, in life and how we're going, we're like, we can't do this. We can't accomplish this. Let me just do it so it's done. But we can learn from our mistakes, and we can rise up, and we can be better versions of ourselves. And yeah, not to lose, ourselves. And it's not just us. It's also the people around us that get affected. Our relationships get affected. And what at the end of the day, we're working so hard is for our children and for our spouses, and whatever we're accomplished, we're building a life. Let it exude positive energy, not come back and be like, oh, that one feeling that drove me crazy. There's more to life beyond that, and look up.
Mm-hmm.
Yeah.
And there's more to dentistry also.
That's just a powerful testimonial.
Mm-hmm.
Yes, more to
Yes.
dentistry. I'm sorry, I missed what you said.
That's just a powerful testimonial, isn't it? It's just and especially the fact that your brother was a very well succeeded dentist, and just the fact that he let go and he faced his fears, and he found some joy within the chaos that he was going through, isn't it? He found some peace there. And I think that's a beautiful message to wrap up this lovely conversation that we had with you. And it would be lovely. It would be lovely to have you again in the future. And you can always count on us to share your brother's story, and in whatever we can help.
Thank you.
That would be a pleasure for us.
Thank you. I appreciate it. Thank you both for taking the time. Yeah.
Thank you so much. Thank you so much, Parul, for your time and for this lovely conversation. I'm going to put all the links in the show notes. The links to Manu's articles, the links to the podcast that you recorded, the links for the book. Everything will be on the show notes. And yeah, it's like Jorge André said, you are always welcome. Me and Jorge André, we have a course in the south of Portugal, which is conscious leadership in dentistry. You are very welcome if you want to join us.
It would be lovely to have you.
It will
bring your family.
I don't know if you ever been in Portugal, but you know
Not
Portugal.
Yet. It's on the bucket list.
Okay,
I've never been. I've been to Spain, France, and I've been all around, but not to Portugal. I've been around the other countries.
You are invited. If you ever come, let us know. And if you want to join us in our course, you are very welcome. And thank you so much.
Thank you.
For your
Appreciate
time.
that. Of course. Thank you.
Thank you so much, Parul.
Thank you.